So thank you for the opportunity to present our work. The subject is, it's not up yet. The subject is the results after prosthetic mitral valve implantation in patients with mitral valve annulus calcifications. So regarding MAC, mitral annular calcification is a common degenerative process that's involving the annulus of the mitral valve. Generally, it is an incidental finding that's associated with aging and occasionally may cause significant left ventricular obstruction and symptomatic MS. We have seen several reports that have shown that mitral valve replacement in the presence of MAC is associated with worse outcomes. You can see here the pictures that show the pathology of the calcification going from the annulus and into the myocard. And you can see heavy calcification here in the coronary angiogram and here in the chest X-ray. Carpentier, back in 1996, described the calcification and divided them to 4 categories. When he looked on the valves in the on the circumflex of the valve, you've seen that most of the patients, more than 70%, had the calcification only on part of the posterior annulus, and some had the calcification on the entire annulus. When transecting the annulus vertically, you've seen that most of the patients had calcification just in the annulus, but some had calcification that went into the papillary muscle and into the myocard. So that entails a bit of a problem when trying to do a mitral valve replacement. Our objective was to determine the short and long-term outcomes of conservative decalcifications approach for mitral valve replacement in the presence of MAC. Again, Carpentier in 1996 presented a work that he did extensive decalcification. He did an en-bloc resection of the entire calcified annulus and then reconstructed the annulus with the leaves and part of the atrium. In Tel HaShomer, when the work was done and I'm presenting it, we do it a bit differently. We do a moderate decalcification. We use a pericardial patch. You can see the brown pericardial patch here. And on the pericardial patch, after a moderate decalcification, we implant the valve. Out of over 1,000 patients that underwent mitral valve replacement between 2004 and 2015, including 2015, 126 patients, 12%, were found to have MAC. Patients with mitral annulus calcification underwent surgery that included various degrees of annular decalcification and circular or focal pericardial patch and reinforcement of the annulus. In order to establish MAC as a significant independent risk factor, a propensity score match control group was created, and we compared between the MAC patient that went mitral valve replacement and the non-MAC patient. You can see here the feature of the group. There were no difference between the groups since it was a propensity, but all the patients were about 70 years old. The functional class, most of them, over 70% in each group, was functional class 3 or 4. Previous cardio operation was done in more than 30% of the patients that were in both of the groups, and the logistic year score was 15 in both groups. There was no, you can see the p-values, since it was propensity score matching, there is no difference between the groups. So we checked the early result in the MAC group and the non-MAC group. Regarding mortality, it was the same. We had 7 cases of mortality in each group, 6%, and morbidity and complication was not different between the groups. Regarding late result, our mean follow-up was 38 months and was 91% complete. And we did the echocardiogram for the patient, And we had 68 follow echocardiogram completed for the entire cohort, with the follow-up was 28 months, a mean of 28 months after the surgery. Regarding late survival, we followed the patients, some of them for 10 years, but our median follow-up was, as you've seen, more than 3 years. And there was no difference between MAC and non-MAC patients that underwent MVR regarding overall survival. The median survival for MAC was 6.9, and for non-MAC was 7.2, and it was not significantly different. Late follow-up, we were following the patient, and we checked their functional class, and there was no difference in the functional class between the groups. As I said, we did a follow echocardiogram around 3 years, a mean of 3 years after the surgery, and it was 152 patients that went the echocardiogram out of more than 200 patients. And regarding the gradients, there was no difference. The MAC patients were not inferior to the non-MAC patients, and our regurgitation, most of the regurgitations were trivial or mild, and there was no difference in the regurgitation between the groups, and there was no paravalvular regurgitation in the MAC group. If I was to conclude, so we think a relatively conservative approach to MAC with minimal decalcification and with pericardial patch reinforcement provides good early and late clinical outcomes similar to mitral valve replacement without the presence of MAC. Thank you.